Okay, so the topic today is actually a few things in regards to writing a research proposal, as well as what's the difference between a research proposal and how it will morph towards the end when you either publish it or when either you end up actually writing it up as a thesis. I'm also going to be showing some, for very specific to general surgery, some rules, but I'll keep that towards the end. And the other thing is in terms of templates which are available for your PowerPoint presentation and how to use it correctly, because sometimes the templates are used blindly, and that's not why we have created that. It's a generic template, but you have to cater it to your use. And I'm going to show some examples which I was able to get from your seniors. So I'm going to show some examples towards the end. But before I move forward, I believe I would like to know who is here. How many of y'all, maybe you can put it next to your name if you're year 1, year 2, year 3, and what program you're doing. So that makes it easier for me to know the audience which I'm having at the current moment. So just edit your name. You know how to do that? And you'll kind of put year 1, year 2 next to your name. Or you can put in the chat box what year you're in, and I can look at the chat box, whichever is more convenient. All right? Can you do that? Yes. Okay, yeah, year 1. Okay, so most of you are year 1 so far. What about the rest? Okay. I'm not getting, the rest have not filled up. Okay, so generally most of you are in year 1. I believe based on whoever has actually put a year next to your name. So let me move forward in terms of, you've already, I'm pretty sure most of you all would have attended some of the other talks. So I'm not going to overlap much of what has been already said by Prof. Vairavan in terms of how to start a research project and so forth. But at the end of this particular series which I'm doing, I'm hoping that you'll understand the difference between when you are writing something up for a proposal, whether it's for ethics, how it then changes when it becomes a thesis document or when it comes a manuscript write-up. Okay, and that's important because the language changes from proposing and planning to do, I plan to do this, I plan to do that. You'll end up saying, I ended up doing this, and I ended up finding these results, and this is what the results mean. So the whole, how you present it, how you, and the written form is very different. Okay. And then in terms of, I'm just going to clarify what the difference between a research question, research hypothesis, and research objective is, because it seems to be a common trend which still is quite confusing among most of the people who come for progress evaluations. Okay, and the next thing, which is I'm going to kind of say the difference between a research methodology and methods, because methods, you go in detail and you kind of put that into your thesis document, exactly step by step what you did. But methodology is kind of the overall picture of how you plan to do something and how it generally happened. Okay, it's the overall what you propose to do, and you don't go in details, and that's probably what you end up presenting when you defend, and in terms of when you end up proposing and what you put in the ethics. But when you put in the document, you actually put in the method. Every step is not missed out when you write it up, right? And similarly when you write it up in a paper. Okay. And then towards the end, I'm going to give some examples as which I've mentioned. So just as I was saying earlier, so in a proposal, so there are going to be similarities. Everything needs an introduction. Part of the introduction, you will have your rationale why you're doing the study. You will have what your research question is, what your research hypothesis is, and what you plan to do. What are your aims, which is your objectives, and what you expect to find would be what is going to be in your proposal. And you kind of actually put the methods and the logistics in terms of the methodology in part of your proposal, and then you would kind of propose what you think the expected outcome is going to be if you run this comparison or if you run the study. Okay, there are other things which you might need part of your project. In most cases, you'll definitely need ethics clearance, and you might need funding. So you need to look into putting a proposal up to get funding, not just to get ethics clearance. And you also might need to register, if it's a trial, RCT, register on a trial website. Okay, and that depends on whether you're running an RCT or not, and or if it's requested by the ethics committee. And you must be very clear from the beginning, even though you are the student and you are running the project, you might get assistance from your supervisors, you might get assistance from research office in terms of stats or outside help and so forth. So you need to know what your role is, which is basically driving the whole project, understanding the project, being able to defend your project and write it up and so forth. But you need to know what the other people are doing as well. Okay, because that is important if at the end you're going to do it as I'm not sure whether any neurosurgery students are here, but I believe that for you guys, it's not a thesis document you're going to actually do a manuscript. And then for the thesis document, you actually will put an acknowledgement. And so you really need to know who you acknowledge and who you actually acknowledge, saying that they are part of your supervisors and who are going to be possible authors, and compared to who you're acknowledging for their help. Okay, so there's a difference between those things. Other things which differ between a proposal and, when I'm saying manuscript here, but it can also be thesis, is that obviously the content of a proposal is what you plan to do, what you expect to find, and like how you think this is going to change practice and so forth. Word count is probably based on the ethics application or grant application. They will propose the number of word count or limit there is, so you follow that. Both sets will need references. Probably you'll need less references during the proposal session. And then obviously once you write up and you have more, you probably have more references coming in when you start to discuss your findings, okay? And as I mentioned earlier during the first slide, so you will write the proposal in either present and future tense, because you're proposing what you're going to do. I plan to do this, I plan to do that, compared to when it's a manuscript, thesis, and so forth. It's written in past tense, except for the abstract, okay? And then in manuscript, again, you will kind of change your figures and tables, which you might have, into a more concise consort diagram. And this is something which is also important for you all when you are defending, that you don't come with words and words and words of trying to explain what you did in steps. You can actually put it into a nice little consort diagram, which shows what exactly happened, how the collection happened, what numbers you had, what numbers you excluded, and so forth. And you don't actually need to propose when you're trying to defend, if that makes sense. Okay, I'll show you some examples. This is an example of a Gantt chart from a long time ago. I know you guys do put this into your proposals, but we give it as an example, but you should actually use this as your own guide on whether you're keeping up to your timelines or not. So you're proposing this not for us to say, okay, yeah, that's fine, but it's actually for you, so that you know that if you're falling behind, you already can flag yourself up. You don't even need your supervisors to point that out. You yourself should already know that you're falling behind, and you can already look for your supervisors to say, I think I'm falling behind. Can you suggest how I can fasten the process of getting ethics clearance? Maybe that's where you're having the hinder. Or maybe you realize you need funding, and maybe you need to then discuss with them, if I can't get funding, is there anything which I can do which in the same topic or same field, which I can move and morph it to where I don't need funding. So you should feel comfortable enough to actually approach your supervisors to discuss if you are having issues in keeping with the proposed timeline. But obviously in the beginning itself, when you propose this timeline, please don't propose something which is unreasonable for you to keep up. You need to propose something which you know that, okay, I've got 4 years, but it's not 4 years, it's actually 2 years. I probably need data collection, I need a year or so, in depending on what you're doing. And so don't propose something where if you need a year to do data collection, but you think you can do it in 3 months. So don't go and restrict it. Give yourself buffer time during your Gantt chart, in this Gantt chart itself, so that you don't fall behind. Okay, it's good that most of you here are from first year. Okay, now components. Now this is generally components of a manuscript. I have this here because there's a wider audience than just general surgery students here. Probably in fact, you guys are encouraged as if you guys can try and publish a paper before you go for defense. It actually gives you uh, a, a little bit of a legway that you've actually published within the period before you're defending. This is for general surgery students. So you could consider actually publishing, and part of the headings which you have in these things which you need to look out is that you should be able to write a cover letter to the journal. You need to know, have a finalized title, be very clear who your authors are. Prof. Shankar should be giving a talk on this next week in terms of more details on deciding on how to choose your authors and so forth. So I'm not going to go into it so much, but these are the general headings which you will have in a manuscript. And it's not that different from what you would have in a thesis, but the difference is it's more concise, right? And then you need to read guidelines. So when I say guidelines apply not just for when you're writing a manuscript for a journal. You have to read the guidelines, which I'm going to show you soon. You guys actually have guidelines for your thesis write-up, and I'm going to show that later. Okay, and also you need to see how they want the figures and tables to be formatted, font size, all of those things matter. And in terms of manuscript or theses, you normally will have declaration statements. And the thesis is normally in the beginning, in the first few sections of your thesis. I'll show you the template of the thesis right up. And you might have supplementary documents or appendices. In theses is appendices at the back, which is if you used a questionnaire or anything that you'll put that as part of your thesis document as examples of to show them what exactly was used to run your study. Okay, and similarly you might consider supplement documents which the journal might require. Okay, and furthermore, okay, now this is important because there is misconception that you can't do audit as a project, but the problem with when you do a topic which is audit related, where the method is where you're collecting the data in an audit format, you still need to have a clear research question, research objective. So because if you are collecting retrospective data, you might have already your supervisor might have an existing database, but does not mean that you come and present it in a very audit with pie charts and bar graphs and just talking about numbers. You need to explain why you're trying to show those percentages and numbers to us. What is the question you're trying to answer? What is the gap? So there is a difference between a research report and audit report. Okay, so as it's clearly different shown here, the whole idea of a research report is that you are trying to convince, it's question based. You're trying to show arguments which are or fill in gaps which are unclear, and then you're trying to use data as data from that audit. Sorry, I'll go back. Data in that probably by doing audit, but you're trying to use that audit as evidence on why you should go with a certain surgical procedure compared to the other, something like that. All right, and you analyze and you actually inform people and you make clear conclusions, and the conclusions should not just be repeating the results. While in an audit, you end up just giving general discussions. You will summarize the data which is collected. You will present in bar charts, and then you kind of just report the findings in terms of numbers and percentages, and then the end. But then you're not actually making any, you're not moving it to the next step where you are actually giving clinical reasoning and so forth. So that's the step which ends up coming out as an audit when you guys come and try and present retrospective data collection, database data projects and so forth. So try and understand that auditing is actually a very important process. It is good that you want to do something which is database related, but learn how to tune the language according to what you need in terms of how it is actually clinically relevant. Why did you end up doing this audit collection and so forth? Okay. this is just an expansion of what I was already saying. So there is a big difference between the, which I've already said earlier, there's a big difference between proposing and at the end product. Okay, so you will end up having the similar sections, but the wording ends up being different. Okay, so the thesis ends up being a longer version of it, and you actually have a section which is normally chapter 2, which is the literature review, where you might have it on your PowerPoint slide as a little table summarizing the element literature review, but you'll actually put it in depth in writing in your thesis document. Okay, so I'm going to share these slides, but I'm not going to go in detail in every single point here, but this is a general rule of thumb which I follow. Other people might follow other things, but when you write your report, this is more towards like when you write a manuscript, rather than when you write a thesis document. But even in a thesis document, my rule of thumb is when you're writing up a paper, you probably don't want to have more than 3-4 paragraphs, especially in a manuscript. Maybe in a thesis, you might have more than 4 paragraphs, but each paragraph should have a topic sentence. I believe in Karangan it's known as EC, right? So you need each paragraph start out with what is the opening sentence, and it normally goes in introduction, you go broader. What is the burden of or what is the big problem? What is the burden of the disease, or whatever you're trying to do? Okay, or like if it's nothing to do with disease and it's something to do with what is the problem with the education system or something like that. So what is the bigger issue, and by this problem, what is the downstream issues which are going to be faced? So you say that, and then you rationalize it. Then you bring it down to, and because of all of this, some people have tested this method and this method by way where it is concise, and so you'll end up bringing it down to. And so in this project, I'm going to look at the small little aspect, which is what. Okay, so that's how the introduction should be. So then it will lead to the research question of this project is, the objective of the project is, so my possible hypothesis is, and how am I going to do this project? So then you propose, okay, because I'm going to do, maybe it's an interventional study, I want to do RCT. Maybe it is something to do database, so I want to do a retrospective study, and I want to collect the pro forma, and I want to collect these data. So you kind of that part of your introduction. And then, so I've already said this to you. So your research question is a question. So you have to ask something. It has to start with what, when, or something in that line. Does this make a difference? Okay, so like it needs to be a question. Okay, it cannot be something which ends up being a statement. The statement actually is the hypothesis, which is the answer to your research question. Okay, and your null hypothesis is the default. That means the one which is like it's not going to happen. Like it's opposite to what you believe is going to be the true answer to your research question. Okay, and the objective is, now the best is that it has to be some sort of binary and something which is measurable. Okay, so you're either going to say you're going to compare, either you're going to measure it, whether you're going to assess. So these are just ideas or starting words. Does not mean these are that you stick with this. It's something which you bring up to your supervisor and you check whether the wording of your research question is correct, whether the wording of your hypothesis is correct, whether you should say that you should measure, or whether you should say you should assess. You recheck with your supervisors. Okay, now, so moving along, so in your material and methods, you will be covering things like what tools you use, what were the patient cohorts you dealt with, what were the outcomes. Now, outcomes is best to break up of what your primary outcome is and what's your secondary outcome is, and then you'll bring it towards the end on like how you write these subsections, okay, and what statistical analysis is. I noticed there was a typo there. Okay, so, and you will also, part of your methods, kind of use what sample size you're going to be using. It could, if it's an RCT, you probably use something like this, which I'm proposing above. But there are a lot of actually websites which are useful, but I believe that maybe it's technical. So seek advice from people who are able to help you with this. Besides ourselves, there's also RMC office, which have a lot of statisticians who could help you, but go with the right material when you do that. remember how I mentioned, so in the beginning, you might end up proposing these are my exclusion criteria, and you might end up putting it as dot points in your slides. But towards the end, when you are actually presenting it as your final defense or pre-defense, normally we suggest that try and make the 6 months before your actual defense as a trial run. So by then you should have something which actually shows a concept diagram of how many numbers were recruited, how many were excluded and why, how many were included and why, how many were excluded and why, and you kind of drop it down. This one's showing a very RCT model, but there are different kinds of flow diagrams for different kind of study designs. So I'm not going to show every single example, but this is for an RCT. So look for one which is suitable for your study design. Okay, and draw up and create a flow diagram which is clear, especially towards the end. Once you started collecting data, you should be already morphing into this. In fact, you can have a template ready, but you might not use it until you are able to fill it up with numbers. Okay, and other things which you want to put. So this this applies whether it's your manuscript, whether it is your thesis document, whether it's your PowerPoint slide. You normally will, first slide will be the baseline data, what generally the demographics of the subjects you're dealing with. Okay, whether it is, even if it's a survey among students, you still will say these were demographics, how many were in first year, how many were in second year, and so forth. Okay, so, and it generally want to show that it is comparable between the groups. And that's the whole idea of showing the patient characteristics and the baseline data. Then the following, figures are good only if it's going to end up not making it confusing. Like pie charts, don't put things which are just going to show numbers and percentages, but if you can do box plot to show the difference between mean, because you're showing between the treatment A and treatment B, box plot might be useful, but again, bring it back to your supervisor and see which way is better, whether to putting a table or putting a figure would be a better way to represent your finding. Okay, and then in terms of your table, in terms of your table, you need to make sure that each result is according to, so yeah, so in your tables, in each result, it's according to your main outcomes. You might have a table or a figure showing what your main outcome finding is, and then your secondary outcomes. So it should be in that flow. It shouldn't be that you're presenting secondary outcomes first and then primary outcomes later. It should have actually a proper flow to how you present and defend your data. Okay, and when you conclude, you probably have an opening statement in which you will kind of summarize the general reason to remind people. So it summarizes everything which is from intro to this was done. And then you will start to discuss each of your finding, and you will give the pros and cons to your finding, like a debate. I believe in school, we used to write a lot of essays where we are asked to write a debate essay on the pros and cons of something. So that's basically what you do. But the difference is in here, you use your results as the evidence of why you are either supporting it or rejecting it. Okay, you might end up rejecting it. You might initially wanted to support it, but your findings end up showing that you have to reject it. Then you have to explain why you're rejecting it based on your findings, based on other literature. And that's what happens in the discussion section. Okay, and this is whether it's a paper, whether it's a thesis, and so forth. Okay. And the conclusion at the end kind of summarizes the discussion, and it should be as it should be. It shouldn't oversell on what is actually found at the end of your research. It should actually be, it doesn't have to be more, it can be 3 sentences, it can be 5 sentences, but make sure it is a summary of everything. Another thing which you will have in your discussion is suggesting what were the limitations of your study, what was the strength of your study, and what will be the future direction, what should be done next based on what you found. Okay. So I am putting this diagram here. I've got another set of slides which I want to show you, which is all about formatting, which is equally as important as what I'm presenting right now. This is a bit of the content of what goes in, but as you can see, it is not that your slides will end up actually having, it will end up morphing, and you'll end up having version 1822. So, and this is not just for a thesis document, this will also happen for slides as well, which I would show you shortly towards the end. Okay, before I move to the next set of rules and regulations and so forth, does anyone have any questions? No? Any questions? You can put your questions in the box, maybe at the end I'll answer. Okay. The next thing which I would like to show you guys is, rather than showing the rules and the theses, first I need to show you some material so that you can see what I've been going on about. Okay. Escape. Give me a sec. Okay, so this document, okay, so before I show you this document, I want to show you the already. So the university actually, so this is for GS, but I believe, Prof. Shireen, you're here, yes?
Yes, yes.
Yeah. For the university, I mean, for your program, do they write up a thesis or a paper, or what is their final format?
They have to have it in that hardbound copy that they send to the office.
Okay, so the same thing as, so this
Yeah.
is the rules which is from University Malaya rules in terms of writing a research report, dissertation, thesis. For you guys, it's actually a dissertation. Okay, reports are normally more to do with undergraduate, and then dissertation and thesis is more to do with master by medical science. So forth. So even though we interchange these terms and say these things, you guys actually doing a dissertation, and that's why it's a CD document at the end. So this is actually, I'm not going to go through every single detail here. And this document, as this is the university guideline at a faculty level on how you should structure your theses. So they do propose that you can do it as a conventional format, which is normally the format which most of our students end up doing. But you actually have the option of doing it as an article, which means you actually have an opening, and then you end up just putting, you can put your article, like how you would write it up for a particular journal, and you can just conclude. And so, which is one of the ways which I think I prefer asking most of my PhD and Master of Medical Science students to do it that way, because it just makes it easier than they just take that chapter and they try and convert it into a paper. Okay, and the other one is by published paper format. And all of these formats, as much as you think it's not available for the, well, I can speak for Master of Surgery, that you can actually do your thesis format in any of these three ways, and it'll still be accepted as a written dissertation. Okay, and I'm not going to go, as I said, in details on every single thing here. There are, what I'm going to highlight in my talk, in the next one, is the difference which we have between this document and the, we came up with this, Prof. April and myself, in 2018, where we kind of give an kind of like, how do I say, like instructions which, following the format of the original thing, what is more appropriate way for you guys to the changes which you can go. So you, as you can see, you can actually follow any of the formats. You can choose to, this is a general body headings which you should have, and towards the end, in terms of the formatting, normally the university wants you to do it as author date style, which is you put the author's name and the year, but we suggest that you can actually do it in terms of numbered style. Okay. And the other thing is the word limit, because the overall one gives a maximum word count, but they never actually specify a minimum word count, and we've kind of done that for the different formats. Okay. And yeah, so the other thing which I want to show, okay, the checklist I'll show you later. I want to show you the thesis document. So this is the template given by the university. Don't worry, all of these templates, the guidelines, all of these things, I will be sending it to Nadia, and Nadia will send it to you guys. And so this is the university template for theses, and you can see they've already actually formatted. So remember, it's a declaration. It is at the beginning, and you have to, they have it in both languages, and you do the abstract. So for GS, we agreed that you don't need the Malay abstract actually. And so we have excluded that. If you don't have it, we are not going to penalize you for it, acknowledgement and so forth. And as you can see, they've already have a preset template for you guys to follow in terms of how to write your introduction, and how do your tables and figures and so forth. Okay. And the other document which I want to show you here, okay, I'll come to that marking thing at the end because that's important. All right, before we proceed, I will give you the differences between the different slides. Okay, so I'm not sure why it's doing that. Right. Okay, so in terms of, so I've shown you both of these documents. Okay, so you need both in order to get a clear understanding of what you need to do in terms of writing up your thesis at the end. Okay, as I said, you have 3 different options which you can follow, and for Master Surgery program, you can actually pick any of this format, but speak with your supervisor which one is the best way to move forward in terms of your work. As I highlighted, there is a word. This is one of the differences. We have actually limited, given you the minimum number of word counts because maximum was not very clear on. It made people confused, especially during 2015, 2016. So we decided that maybe coming up with a supplementary document would make it clearer since the general one is a bit confusing. In terms of all the 3 formats, in the beginning bit, you will definitely need all of this. Your title, you have to declare, you have to acknowledge, you need your table of content, list of figures and tables, as well as symbols, and the list of appendices. Remember I said you might put your questionnaire at the back and so forth. So you'll put like so this is basically saying where you can find what page you can find things, okay? At the back, you will have if you have published a paper, you can put your publications, conferences you presented, or awards which you have received, all the supplementary document, your ethics approval document, and so forth. Okay, and if you're doing it according to by public paper format, you might need to also put the consent of your other authors as part of your supplementary document, part of your thesis write-up. Okay. Now, in the conventional, it's the one which I've been showing you guys: introduction, literature review, methodology, results, discussion, and so forth. The difference is that when it's in the article format, you end up having 2 different introductions. Go back. You have 2 different introductions. One which is in the article itself, like remember I said in the manuscript, you'll just kind of have 3 paragraphs saying this is what the paper is about. So you'll put that paper in, you'll write it up like how you would plan to send to a journal, but you actually haven't published it yet, and that you're just written it up ready to publish but not published yet. And that's what fits in as chapter 3 in your article style format. And you put your general introduction, which you should already have, because that is what you would have written up in terms of your ethics proposal and in your research proposal. But the difference is, remember I said that in your thesis, it needs to be in past tense, not no more in present tense. Okay, and very important, chapter 2, literature review, all the background which is related to the topic which you're dealing with, you need to put in a decent summary of the literature in the topic which you are doing, and that is still needed. Okay, and then your conclusion, as I've already highlighted to you, you need to say conclude. You kind of say then what the limitations are and the future directions, what you recommend should be done. Okay. Now the next thing is, sorry, it's not okay. Now, also important, there are rules in terms of your of how the cover letter of your thesis should look like. And I'm bringing this up. I believe this is useful for all programs, especially because you will end up doing a book at the end. And this is how it should look in terms of the size. And if you follow the template which we're giving, this should be already preset. But of course, if you end up editing and you move the formatting aside, so it's better to double check that the formatting is still according to this. Okay. And if you and this is how it looks when it's printed. This is the hard copy version. When you do come for your pre-defense, you just going to be you will actually come with just a loose version of it, which you don't need to, sorry, it's jumping. Apologize. Okay, so the final look will be this, but when you actually come for your CD defense, we don't actually ask you to come with this hard printed. This hard printed is once you have passed your defense, you need to do the hard copy like this. Okay, but for your thesis itself, it can be a ring bound, or you can even just come with loose sheets and have a clip on, and we will accept it, but make sure the content is the final content which you plan to do in terms of printing and doing the hardbound, which is shown here. The other thing which is asked is that you provide a CD, okay, a soft copy version of your hard copy thesis. Now, previously, they normally ask for 2 copies of the printed version and 1 CD. For my PhD student right now, they have said that they don't, for 1 printed copy. So for those kind of things, you probably want to check with Dean's office or your own program coordinator. But the CD, I believe, still applies, because this is what now library does to archive all theses, since they're trying to reduce the use of paper. Okay. Now, in terms of for GS program, rather than doing author date style, you can go with the Vancouver number style, but you need it with a square bracket, and this is how it should look towards at the end. And within the text, it should look like this: superscript, square bracket, and it's 1 and 2, you say N. If it's more than 3 references, you would put comma, and you will put a dash. If it's 1, 2, and 3, you put 1-3. Okay, and it should be superscript, and this is how it should be within your thesis document. Okay, and it is very important that this is why you're declaring on the first page, is that you shouldn't plagiarize and avoid plagiarism, and because of that, you have to run your theses, your final thesis, before you come and defend through the Turnitin software, and it should be less than 25%. Okay, 20%, less than 20% for GS programs, but the university rule is 25, but for GS, they have made it clear that they do not want it to be more than 20%. Okay, so if it's on 20%, it's accepted, but 21% is not accepted. Okay. Other rules which are important is the print, the margins and so forth, which I kind of showed you in the diagram, but this is listed. It's easier for you to do it. So what I suggest is you have this as checklist, and you counter check that you have your theses, your final theses in this format. Okay. Right. So, and in terms of footnote, it's normally done in this style, where you would put it as a superscript number, and you will put a footnote, and that'll be at the bottom of the page. Okay. And okay, so I do have these sheets, which this is actually what we use to mark y'all during your different stages, but actually there's a different form for each stage, which I might show you the form instead of this, but this is for the final stage. This is at defense. So when you are being assessed at the end, this is what we are looking for. We will definitely look at the general rules. We look at the thesis format. We look at your slide design and presentation. I'm going from bottom up. Okay, turn it analysis, so that make sure that is less than 20% and so forth. Okay, and 20 or less. Then looking from the top, we will look at your title and see that it's clear, that it covers everything, that the design, the outcome, the title actually makes sense and so forth. And for that, so we'll end up actually ticking, and it will be one or the other. Okay, then in terms of the introduction, we'll see whether you clearly set your problem statement, that it's clearly phrased and so forth, that the problem is clear. And we will see that whatever literature review which you're presenting to support your problem, to support why you're doing the study, is there and it's not missing. Your methods as well, we will look at whether what you're using, the way you're using, the method you are using to choose to test your research question or test your hypothesis is correct. that you have implemented what you propose to do correctly, and that you are interpreting your results correctly, and that you're making sense and discussing the results when you're making sense of your results. Even if everything is not significant and you end up discussing it well, we will still pass you. But if you end up showing something else and saying something else, it's very hard for us to help them. Okay. And that's when you kind of highlight, yeah, although I've done all this, there are a lot of limitations such as A, B, C. Be transparent. Okay. This is towards the defense. And then conclude your conclusion. Don't oversell your project. Don't undersell it. Say exactly what was found and why it's important, and so forth. Even if it ends up being not something practice changing, say something which is relevant to why you concluded correctly, basically. All right, so thank you for listening. My talk is not totally over yet because I've got a few more things which I like to show you guys. Okay, so these are just my slides, but there are things which I like to show in terms of material, which will be shared later. But I believe if I highlight it to you, then you can see why you should refer to all of these things which we are sharing with you when you're doing your work. Okay. The other thing which I wanted to bring up, which I mentioned, is how you're being assessed. So this is the assessment sheet. So as I've told you, so for the first years who are here, you first, when you come and present to us what we are going to look at, we look at the same things from the beginning, but the difference is in the beginning, we're going to first check that your project is feasible, that you will be able to accomplish it within the time frame, that what you're doing, there is some importance to it, and then it's worth for you to pursue. We'll also see that whether there's some new kind of, as what is the new bit which you're going to bring by doing the project. It doesn't have to be groundbreaking science, but by doing this, okay, we kind of see, okay, if you do this, this is the direction it's going to be. You are going to answer a little bit of a gap which is in the project which you're trying to propose. Okay, and then we will kind of look from the beginning whether you are applying to ethics, whether ethics is cleared, and so forth. And this is how you know that you are progressing, that you are on point. Once your project is cleared, and if you're executing the project as planned, as approved and suggested, you shouldn't be facing major issues. Okay. And then we will look obviously at your sample size, what you're proposing as sample size, and whether you need funding or not. Maybe your project doesn't need funding, then we will still say it's satisfactory because it's something which doesn't need funding. But if it needs funding, then it cannot be satisfactory because you need to find the money to do the project. Okay. And very important, the slide design is important. Okay. Sorry. Let me move it along. Okay. So then towards the middle, we start looking at your progress. So where's the middle? Probably after, if ever you are someone who is on point, probably even by your second year, we could be looking at a form like this, but probably most of y'all will be when you are moving towards third years when you're looking at your progress. But by the middle of your third year, we probably be using the last form because we want to see that you should be able to wrap up on time. Okay, so by this time, you should have already gotten your ethics clearance. You shouldn't be saying that you're trying to get. So by second year, you should already have your ethics clearance when you're moving into your second year, that is, and that you've already starting to collect results. We want to hear that you started data collection. We want not just here, we would like to see your dummy tables, what you propose, how you plan to analyze, so that we can actually, the whole idea is then we can actually give some ideas on how to improve it and make it better, so that by the time you get to your defense, it just gets easier, that you are able to defend and understand. You then should be going in depth in towards the end of your of when you're defending. So when at this point, I've already highlighted this to you guys just now as the first thing, because I was showing you what you needed for your final outlook of your thesis document, right? Okay, so the next thing which I'm going to show you is, or one of the final few things I'm going to show you is I actually got this from two students. Okay, one is Joy. I'm going to open it up. Give me a sec. Okay, I'm going to open it up, and I want to show you this because it is important. Okay, so this is version 8 she wasn't able to send me the final version, but she said this is not the one she used for the thesis. But as you can see, there was version 3 and version 8, and she's telling this is still not the final version. The reason why I am showing these examples to you guys is because you need to understand when you start in first year, things are going to keep changing and you're going to keep editing what you are doing. Sorry, just give me a sec. I want to open the first one. So when she first proposed, this is how she had it. I mean, that's not, I don't think there's anything major in terms of having lots of figures and so forth, but this is how she started off in terms of presenting what she's going to do during her first year, or probably if it's version 3, probably towards this, between the first and second year. Okay, and then this is how she came to us. Okay, with why she wants to do it, comparing between the lists. By the way, this work has been published this year. Okay, after her defense, and then why, and her objective, methodology, and sample size. She proposed sample size, and what the flow is going to be like without the numbers. Okay, and then and ethics and so forth, but it still needed improvement because probably the inclusion exclusion criteria needed to be clearer. Then towards the end, this is not the end though, but towards the end, you can see that it has changed, right? She starts with the introduction, she explains the procedure, she has more literature review, she explains why she needs to do it. Trust me, this wasn't her final look as well. She's changed it quite a bit from this version as well. Then she explains her study design, methods, and then she puts in the flow with the numbers, okay? And the general distribution of the cases. Then she highlights what her primary and secondary outcome were. Sorry. Okay, so then she shows the distribution, and then she shows what her primary outcome is. Okay, and then she shows the results of a secondary outcome, and then she gives her key conclusions, which she believes are. But again, this wasn't her final CD defense. This was, she said this was two rounds before the final. She edited more, okay? But this is, as you can see, there's a big change between what she did as a slide in terms of when she was proposing towards the end. So things will keep changing, and that is because one, you're proposing, the other one where you're already starting to present data, you're trying to make sense of what you're presenting. Another set of example, but I'm not going to open every one of it, but it was sent by Stephen. Okay, so this is for CR colorectal navigation program. So he was able to send me all his versions from 2020 to 2022. I'm not going to open it up, but what I could do is I'll make it into PDFs and I'll ask Nadia to share it. But you can see the progression from the different years until towards the end in terms of what he had to defend. Okay, so why I am saying this is because we do give you guys a template. Okay, so let me show you that template. We do give you a template. Is it? Yeah. Okay, so which was set by Prof. Varun and myself. We didn't set this template for you to make your presentation rigid. In fact, you should cater your presentation and make it your own. This is so that you don't miss out anything important. And again, when we put this table, we have seen errors. I've seen this myself. No, this thing, when we say data and comment, we're just giving ideas. Doesn't mean you leave it as this. You could change it. You may not want to put the author in the beginning. You might just want to put the reference number and say reference, say 1, 2, 3, and then later say what 1, 2, and 3 is. You might not want to put it that way. And then you might not want to put the title. You might just want to put the year of the study, and you might want to say what the study design is, whether it's retrospective, prospective, and so forth. And data, maybe want to present what their main outcome finding is in this. So you need to discuss again with your supervisor what you want to put, and you don't want to overcrowd this where you're copying paragraphs from paper into this table. So please don't do that. This is just giving you like an idea how to present literature review to us. But if you find a more simpler way, more easier way for your panel to actually assess you and give you some feedback, do it that way, okay? But a table it is useful because it kind of tells you the studies which are already done and what you're going to do next and why it's going to be different, right? And again, we ask you to write the problem in this. So this is a structure which we created in terms of when you're going to propose. But as you can see, you end up doing it as when you progress along, and especially when you're defending, it doesn't mean you stick to this structure, right? Here we're just telling you, don't forget your inclusion criteria, don't forget your exclusion criteria. But when you are actually doing your defense, the inclusion criteria and exclusion criteria should be part of your consort diagram. Now, I can actually show you quickly one example of that. Just give me a sec. I need to open it from a recent manuscript. Okay, so let me see if this works. Okay, can you see it is part of the diagram? Okay, the inclusion and exclusion criteria. The eligible criteria is the inclusion criteria, randomized, exclusion criteria, put in numbers. So this is how it kind of should look towards the end. Again, this is another RCT. But there are ones where you can do flowcharts for non-RCTs as well. Okay, so what I am trying to come across here is, I'm going to stop sharing first so that I can see y'all. Okay, so what I'm trying to share here is from the beginning of your writing journey or your presentation, be ready that change is going to happen, and there will be questions which will be asked. So you need to do a lot of reading. You need to be able to pick a topic which you will like, especially with the first years. Pick a topic which you know that you're not going to get bored, because it's a decent 2 to 3 year journey with that topic. So don't go pick something which is bigger than you. Don't go and do something which is going to be in 3 years time already answered by somebody else. So you need to try and make the project your own. And keep in mind, you're not doing research to become a researcher like me, but you're doing this because it teaches you critical thinking. It teaches you how to actually decide on clinical practice, on which way to actually make sense of evidence which is out there. So literature review is actually a very important part of, as much as it seems daunting to do literature research, it's actually that's probably what you are going to end up continue doing even after your thesis, because you will need to, even if you go to private, you will need to read up on what the current practices are and see whether you want to implement it into your practice. Okay, so that's all I have to say for today. All the things which I'm sharing will be shared to you post this within this week. Okay, do you all have any questions? Who here has already started? You have any slides and stuff like that? I know there's a whole bunch of first years here, but what about the rest? Hello? Anyone wants to say something? Or is it all overwhelming? Guys, are you there? Any questions? Do you think this is too much of information? Hello? You know, I'll start calling people out. Is that the way to go? All right, Edwin, you have any questions? Prof. Shurin, you can hear me, right?
Yes, I can. Very clearly.
But everybody else is silent. Did I scare them off now? I'm not sure.
Probably overwhelmed by the information.
Information. Yeah. So more the reason they should ask me clarification, right? In case something
Yes,
doesn't make sense.
indeed. Because
Yeah.
it is compulsory. Everyone has to write it up.
Yeah. So this is a good time for you to clarify something, because I know I'm probably going to get other separate messages asking me after this instead of now. But if you ask the question now, at least the balance 16, 17 of you all will get the same. You probably have the same questions in your head. So if you ask that, at least I would have answered 16 of you all now, rather than having to do it individually post this talk. How many of you all already have topics, or you have started, or you have done the ethics application, or you are planning to do ethics application? Hello, guys.
Hello,
I'm gonna
hello,
ask
Prof.
yeah, hi. Yes.
Hi, Shikin here from Pit Surgery. So actually now I just got my topic and also planning for the ethics approval. But
Yes.
in order to preparing for my Gantt chart and everything, so I would like to ask when is exactly the date for the submission of the thesis, so that I can plan properly.
Okay, so you just started you're in first year. If I'm not mistaken, by 6 months before your exams, you should have already completed your thesis. So which means you should be aiming to, okay, so you're saying your first year, like you just started 6 months or 1 year in already?
No, this is my second year.
This is your second year. So
Mhm.
you should actually be submitting your thesis probably another year and a half from now, or at least to your supervisors to read, and then you should be defending within 2 years from now, right?
Yes, Prof.
Yeah, so which means you need to get your ethics cleared. If you're in second year, you should get your ethics cleared within the next three months. And in fact, it would have been better if you cleared it probably a month ago, but that's fine. If you clear it within the next 3 months, you're still going to be on time. It also depends on what study you're doing. Are you doing retrospective study?
Prospective study.
Okay, prospective study, numbers, because, and are you doing follow-ups and all that? How much time do you need to get the numbers which you believe you need for your study?
Mm-hmm. Okay, so basically my sample size would be 30, and then I will
Yeah,
need 1 year follow-up after
you
the
need 1 year
interviews.
follow-up. So
Yeah.
if you think about it, now you're already in second year, right?
Mhm.
And if you're going to be defending, say you stretch it 6 months, so you only got a year and a half actually, because fourth year is 2 years from now. So you only have a year and a half and you want to follow up. So you need to start data collecting. You should have already collected all 30 within 6 months from now. Then you can follow them up for 1 year, and that's you're very tight. Can you see?
Yeah, understand.
You're coming really close uh to the point where you need to be defending. So what I suggest is try and get, even though I said 3 months, you probably need to try and get your ethics cleared within this month. It's just within this hospital, just UMC ethics.
UMMC and also UKM.
Okay, so you got two places. Okay, so I would consider, in terms of your Gantt chart, you are at risk of falling behind. You're not haven't fallen behind yet, but there is a risk because you got a 1 year follow-up, which you need to make sure you get all the data, right? But
Yes.
yeah, okay.
All right. Okay. Thank you, Prof.
Anybody else? Anyone who's starting who needs to clarify anything? Who else is here? Anyone from general surgery has a question? No? Okay, maybe I should ask this question. Was this information overwhelming, or you found this information useful, or you got a lot to think about? 3 questions I'm asking. So one is, was this information useful? Yes or no? You can vote in the group, or just put your hand up if it's yes, and leave your hand down if it's a no. It's not useful. Are you guys there? One.
Sorry, Prof. I was driving.
Yeah.
Actually. I was on the phone. Just got a phone
Okay.
call.
Sure.
Yeah, and yeah, it's really overwhelming. Then I'm in the midst of preparing for the first years as well.
Okay, a lot of information. Yes.
Questions
Yeah.
will come.
Okay.
Questions will come
So
soon when I start doing it.
okay. So what I would probably do then is share the information, then you guys can actually see it. This is actually recorded, so you can always watch this on the online. I will try and see if maybe this content should be broken up into 2 different sets at some point, but I was trying to do the compare and contrast of a proposal and dissertation, because the issues which I have noticed is that even at defense, people are still proposing, and I didn't want that error to happen for whoever attends for the talk today, so that you guys understand there's a big difference between when you're proposing your project and when you're defending it. Okay, so that the take-home message here is there is a difference between when you are writing up your proposal and proposing it to see whether it can get ethics clearance, whether it gets grant clearance, whether the panel says, okay, go ahead with it. And then you have to execute your project, be on time as possible to collect all the data. That's the middle bit, the progress of your project. And obviously you might not find results, which are what you think you're going to find. It will happen. But at the end, when you write up, you need to then write it in a way that it's past tense. So I've done this, this is what I found, this is what it means. So, and that is during defense. And then you should explain the rationale of why you actually ended up doing this project, even though you already kind of rationalized in the beginning why you want to do this project. There's also a rationale at the end on why you did the project. Because you might find that all the results were not what you were expecting, but you still need to rationalize why it was still important for you to go ahead and do it. So that's the general message which I wanted to get across. There are a lot of guidelines and so forth, which you need to read those guidelines, which I shared, because I'm not going to open it up and read it to you step by step. I only can highlight key things. So that one, I believe, is best that when the documents are shared, you guys read it at your own time and use that when you're writing up and so forth. Okay. Thank you. Thank you for the question.